listening to the Global Heroes podcast, The Deep Dive. We explore the stories behind the headlines of our uplifting news features. Don't forget to follow us on social and subscribe to our free newsletter for your regular boost of positivity.
Welcome to the Deep Dive. Today we're talking about the huge gap in safe and affordable surgical care.
It's a massive gap.
Yeah, and when we were going through the source material, the very first statistic we saw was it was genuinely staggering.
It really is.
We're talking about 5 billion people.
5 billion.
That's more than 2/3 of the entire global population who just can't get surgery when they need it.
And, it gets even more stark when you look closer.
Right. In low and lower middle income countries, the number is, 9 out of 10 people?
9 out of 10 are completely cut off. It's almost total exclusion from care.
Wow.
And that number, it really shows the depth of the systemic failure.
Mm.
So to really understand the downstream effects of that, we can focus on one specific area, cleft conditions.
Okay, so why cleft conditions?
Well, for one, it's one of the world's most common craniofacial differences.
Mm-hmm.
A baby is born with a cleft about every 3 minutes. But it also perfectly illustrates the barriers we're talking about.
Mm.
For an infant, it's not just cosmetic. The medical impact is severe.
They struggle to feed, right? That's the first problem.
Exactly, which leads directly to malnutrition. And then later, you see frequent ear infections, which can actually lead to hearing impairment. It interferes with their speech development.
And the social fallout must be just immense.
It's brutal. The stigma, the bullying, just complete social isolation. So you realize this surgery, it isn't a luxury. It's a critical intervention for survival.
Which brings us to the core of it all. Why is this care so hard to get? The sources point to the classic trio of barriers.
Mm-hmm.
Surgery is too costly, it's too far away, or there's just nobody trained locally to even perform it.
That's the one. The lack of trained professionals.
And this is where organizations like Operation Smile are trying to break down those specific walls, starting with cleft care.
Right.
There's a story in your source material that just brings this wait time to life.
Mm.
It's about a girl named Diana from Piton, Guatemala.
A powerful story.
She and her mother, Olivia, they searched for care for 11 years.
11 years. Just imagine.
And Olivia said something that was just heartbreaking. She said, I thought I was the only one with a little girl like that feeling of being so completely alone with this.
And that's it. It's a combination of all those barriers. Pete Run is a huge rural region, very little health infrastructure. So for 11 years, Olivia was fighting distance, cost, and that feeling that no one could help.
But the transformation after Diana's surgery is where this gets really interesting.
Real turning point.
Yeah. Diana is now proud of how she looks. She has friends. She goes to church. But crucially, she is planning to start school and wants to become a teacher.
And this is where we shift from that one powerful story to the actual systemic solution. It's a crucial insight.
So how does that connection work?
Well, when an organization steps into a region like Petren, they aren't just, flying in surgeons for a week and leaving.
That's not a long-term fix.
No, not at all. They're strategically investing in the local health systems. That means improving infrastructure, getting sustainable equipment, and most critically training the local providers.
So the benefit goes way beyond just the one condition.
Far beyond. I mean, think about it. When you train a local surgical team on advanced anesthetic techniques for a child, that skill is immediately transferable.
To someone else who needs surgery for, a burn or appendicitis?
Exactly. Or trauma. By investing in the training for cleft care, you're raising the entire standard of surgical care for the whole region. You strengthen the entire health system.
So you get this incredibly powerful dual impact. Immediate life-changing surgery for a child like Diana, while also building this lasting health capacity in, 37 countries?
It's a self-sustaining model.
Yeah.
And that really brings us to the final thought we want to leave you with.
Okay.
So if you're listening to this, ask yourself, what is the true return on investment for localized health training? It's not just curing one child. It's transforming a community's economic future.
When Diana becomes a teacher, she's contributing.
Exactly. She shifts from being a recipient of care to being a productive member of her economy. So investing in surgical access doesn't just improve the life of the patient, but the whole family that will benefit. Their whole way of life changes. What other investment offers that kind of radical community uplift? That's it for today's deep dive. Want more? Stay connected with Global Heroes through our newsletter and socials.